Hi you guys, my name is Patience and welcome to today. We're going to talk about like another dental assisting vlog because I know you guys like those. So what we're going to talk about today is dental assisting life hacks for all the students out there and just anybody new to the dental field. Even if you're old to the dental field, just certain things that can make your life easier. So first thing, let's do like a little scenario, make it kind of fun. So you walk in the room, you've never met the patient before, you don't even know the doctor. Let's say it's like a work interview, they throw you in there. All you do is you look at the chart and you know that it's a filling on the upper right side. Upper right side, let's just say it is number 3 and it is a MOD. So you got to do a filling. So what we're going to do is talk about how do you work in the mouth when you're working on different fillings, and we're just going to stick with fillings for now. So anytime you are working on the upper right side, the two things that you make sure that you always have in your hand is always the HVE, which is a high vacuum suction. And then you also have the air and water syringe. Yes, make sure you grab that air and water syringe because I used to be the assistant that clutched on to the saliva ejector for dear life. And I was not letting it go. Nobody could tell me that. I'm like, here's my HVE, jabbing in the patient's mouth, and I have my saliva ejector. And I'm sitting like this and doctor's working and he's like, I can't see, can you grab the air and water syringe? And me being a young assistant, I'm like, okay, and I'm blowing it wrong. So anytime you're working on the upper area in the mouth, the maxilla, whatever you call it, the top, you always want to grab the HVE. You want to grab the air and water syringe. With the HVE, say this is the tooth right here. This is the HVE. You want to get as close as you can on the tooth. You almost want to like suction the tooth up, but you want to, and like I said, we're working on the upper right side, so you can see it better. So you can actually see, you actually have a really good angle of how you can see in the mouth. This is the tooth. You want to suction right here with your HVE, and then you want to have your saliva ejector so that you're blowing air on the mirror. Not only that, once you start to get comfortable using the saliva ejector, you damn near don't want to use the, not the saliva ejector, the air and water syringe. You almost don't want to even pick up the saliva ejector anymore because you're just going to use it to retract and do everything. That's how I am now. I barely even use the saliva ejector. But like I was saying, you take the air and water syringe, I don't know if I said that wrong at first, and you blow the air on the mirror. And then you also can use it to, once the doctor's done drilling, you blow air on the actual prep so that the doctor can see. Sometimes there's blood, sometimes there's saliva, sometimes there's just water, or even like debris from when they're just trimming the tooth. So you want to spray water on there too, and you want to spray air and just clean the area. Upper right side, always remember, just top teeth in general, you always grab your HVE and you grab your air and water syringe. Those are the two things that you should always have in your hand like this, okay? Moving over to the upper left side. Upper left side can kind of be a little easy, but if you're working with a wisdom tooth and say the patient wants a filling on the wisdom tooth, it is so difficult to see. So annoying, and you're like, I'm looking but I can't see anything. A good thing that you can tell, another hack, which a lot of assistants, they're kind of scared to speak up. They'll sit there and they'll just shove it in their mouth and they can't see anything. And sometimes you do work with rude doctors and you just don't even want to deal with it. But a lot of times what I do now is I say I can't see anything, so the doctor will have the patient like lean a little bit more towards you. Or if you don't feel comfortable saying that to the doctor, you can tell the patient,
do me a favor, please. Get out of here. Get out of here, man. Shit, I'm saying.
You can say, just slide your head a little bit to the left. You can do that. If the doctor looks at you and is like, well, now I can't see. I'm like, well, I can't see either. I guess we both can't see. So, you know, you guys have to kind of work and see what works best for you too. So back to working on the upper left side, you're always going to grab your HVE and your air and water syringe again, okay? Because what you're going to do now is you're on the buccal side of the tooth. When you're on the upper right side, you are on the lingual side of the tooth or the tongue side of the tooth. So it's easier for you to just see. This time you're on the buccal or the facial side when you're working on the upper left side. So it's a little bit, it could be easier. All depends on how you feel. But easiest thing is this is the tooth, this is the tooth, this is the buccal. Just stick the HVE on the buccal. That's it. And just kind of slide it up or down based off whether the doctor's trimming on the, say he's doing a prep and he's trimming on the buccal part. Because when you're doing a crown, you have to trim the whole entire tooth into like a cone shape. So you would just move it out the way. Just make sure you're not in doctor's view. Once again, use the air and water syringe, spray it and clear. And you guys are probably like, but you say don't grab the saliva ejector because because we got to use the air and water syringe. So how are we supposed to collect the water that gets in the back of the patient's throat? And sometimes take a break. You can grab that saliva ejector and just suction in the back of the patient's throat. You can do that, but after a while you just get used to it. If anybody who's worked in the dental field and you suction the patient's cheek and you hear that like that loud sound, it's like ugh, and then you just can't help but stop. Everybody just stops and they're just like you're just like, oh, sorry. You know, it's just an awkward thing. But after a while, you just like, whatever. What you can do is when you're suction, so whatever. We're working on the upper right side, upper left side. Now you can see the water collecting on the upper right side. Down at the bottom, though. You can see it in the bottom of the patient's mouth because you have a better view. So you see the water piling up down there. So what I do now is I take the HVE, turn it, so you know how you had it suction against the patient's tooth? And I wish I had like a little HV. Turn it a little bit so that when you suction, you're not suctioning the cheek and you're not suctioning the tongue. There's a certain way that you have to go back there and be very gentle, because a lot of assistants are nervous and they will go back there and jam it back there. And then the patient's gagging, and then you just stab the patient in the back of the throat with the HVE. And like now doctor's looking at you like, what are you trying to do? So just take your time, see what works best for you. But these are the things that you can do that'll make things like move a lot quicker when you're working in the mouth. It just makes things easier. If you are working on any tooth that is a molar, any tooth that's a molar, always grab a dry angle. Dry angle always clears your field of view and it takes that cheek out the way, so it's just a lot easier for you to see. If you have the dry angles that have the pad on them and then the other side almost looks like a mirror, that's really helpful also, because you can kind of see, you could push it back and kind of see where a doctor's working at. You can kind of look. And then same thing if you're working on the upper right side, you can kind of see, you know, like what the doctor's doing, or you can see the prep better. Like, it just makes things a lot easier. Use cotton rolls, okay? Because I've had doctors always think that every time you place something in the mouth, it's for them. No, it's not. It's not always for you, okay? So if you're suctioning, so boom, we're gonna move to the lower left side. Lower left side is the easiest, okay? You don't have to worry about the tongue. That's the doctor's job. Boom, that's out the way. So all you have to worry about is the cheek. What would I do if I'm working on a molar? Let's say we're working on number 18 on the lower left side. Boom. First thing I'm going to do is pop that bite block in always. It's a molar. Number 18 is a molar. It's the second molar. So we're going to go ahead and put a dry angle in right on the cheek. Boom. Get that cheek out the way. If it's a filling, not a crown prep, put a cotton roll over there. You'll hear the doctor, oh, I don't need a cotton roll. I'm using it. I'm using it so that I don't suction the cheek. Even though the cheek is out the way because of the dry angle. But if you want to be extra, you can be extra. But even if you don't have a dry angle, put the cotton roll there. Because that way it just pushes the cheek out the way. And it also collects water so that the patient isn't drowning. And things just aren't always in the way. So you can do that. And then you're going to use the HVE. Prop it against the tooth. on the buccal, because anytime you are working on the side towards you, even if you're working with a left-handed doctor and it's opposite, if you're working on the left side of the patient's left side and it's on your side, then you're always going to be suctioning on the buccal, okay? If you are working on the right side and it's on the doctor's side, that's his side, you are going to be suctioning on the lingual. So, working on the lower left side, always put the triangle, and you always put a cotton roll also, okay? Very helpful. Sometimes it's a tight spot and you can't get all the way back there like you want to. So sometimes you have to use the saliva ejector. But what you always do, don't just do the doctor bogus and just stick the saliva ejector in there. Use a mirror to pull, retract the cheek and stick the saliva ejector back there. Because like I said, sometimes we work on wisdom teeth, or sometimes the patient's opening is just so... What? It's so bad, y'all. I've had a patient that's like, we're like, open bigger. Like their opening is so small, so it's kind of tight in there. It's hard to see stuff. So those type of things help. If you need to use a saliva ejector to just, and it's not a bad thing either if you guys are working with a patient who has a bad gag reflex, or either their mouth is really small and you're just retracting the cheek and you don't have anything in the mouth. The doctor starts drilling, zzz, you go in there with the saliva ejector, suction it out, pull back out, let him keep drilling, go back in there, saliva eject. As long as you are out the way and you are still collecting saliva and water, that's all that matters. They don't really care which one you use, just as long as you're keeping that site clear and they can drill. You will have the awkward patients whose tongues are just extremely big. And a lot of the doctors are trying to focus so much on the prep, and they have those lenses that they're just zoned in on that one spot and they can't really see anything else. You will have doctors that nick the tongue. So what you could do also, which I mean, it's just a lot, but if you have an extra hand and you see that the doctor's kind of struggling with retracting the tongue and he's working on the left side. But like I said, you don't really have to worry about the tongue if you're working on the left side. You can push it over with the mirror a little bit. Just a thing. If you see that the doctor is like, another thing, if you see the doctor is so focused on the prep and the tongue is getting close to the drill, you can say like, you don't want to say, hey doc, da da da. You just grab that mirror and just push the tongue back, okay? Because that'll be his indication of like, what is he or she doing? They're sticking the mirror in the mouth. Oh, I'm too close to the tongue. Like that's just a way of you telling them like you're getting too close, but also helping them out and warning them. So boom, we're gonna move to the lower right side. The lower right side is the most irritating part of the mouth for me. I hate working on the lower right side. As I got older, I mean, been in the profession longer, it's like, okay, well, whatever, but I don't like it. I used to not like the left side, but now I don't like the lower right side. Lower right side is the tongue zone, okay? That is your job. Your job is strictly to retract the tongue and suction. That is what it is. And battling with people's tongue is just so frustrating. Ugh, it's so irritating. It makes you want to like, just take something, throw something. So you got the patients that it just doesn't matter. It's like they have to, you have the ones that always have to swallow. You have the ones that have to swallow while their mouth is open. So they're just, and it's just like they keep thrusting their tongue forward. So you're trying to retract with the mirror. We'll get into that. You're trying to retract with the mirror while the doctor's drilling right by the tongue, and it just keeps pushing his drill and pushing your mirror out the mouth. Sometimes you're pushing it so hard your thumb hurts. You're like, I'm tired of holding it. And then also, sometimes you're trying to retract and you can't retract with the mirror because it's so much water piling up in the mouth. You only have to use the HDE. So, life hack. Let's see if it works. Because yeah, number one, boom, pop that dry angle in, because we just don't need the cheek in the way on his side. He's not even paying attention about it. He's focusing on the tongue too, just as much as you are, because he knows that you're doing it. You're in control of the tongue now. So if it's a patient that has a really big tongue, the things you're gonna hold is a you're gonna grab the HVE with your left hand, okay? And notice how I switch hands. When we're working on the left side, I'm strictly right-handed with my HVE. When we are working on the upper right side, I'm still right-handed with my HVE. But when we are working on the left side, I mean the lower right side, I switch my HVE to my left hand, because I need to retract with my right hand. If it's a patient, like I said, if it's a patient with a big tongue, grab a mirror, you're retracting and you're suctioning with the HVE. Sometimes there's not a lot of room back there. So then you're still retracting with your mirror, but you're able to access your saliva ejector and air and water because your left hand is free. So switch out that HVE and just grab the saliva ejector. As long as, even if sometimes the doctor will say, tell the patient turn his head to the left a little bit. Boom, that's easier for you because all you do is just stick that saliva ejector on the left side and the patient's leaning this way, all the water's coming towards you, so just stick it on the left side while you're still retracting. Those are the easiest ones. Now, if he tells the patient to lean more towards the right side and we're working on, let's just say number 32 for whatever reason, we're gonna place a filling on number 32, and that's all the way in the back, the bottom wisdom tooth. And the patient has a really big tongue and it's a male and he's strong and he is he keeps swallowing and he can't breathe, and you will have them patients that keep sitting up because they can't breathe. So what you're gonna do is grab a mirror. You're gonna grab that mirror. Now you're gonna grab the mirror, push it on their tongue, and if you have room, grab your HVE, just suction around it. But if you don't have room, grab the saliva injector and just keep pulling in and out when you see that the water is starting to fill. Doctors aren't too concerned about the water, but don't let it interfere with their prep to where they can't see and then they telling you suction, suction, suction.
What? Bro, what are you talking about, man?
Suction. That's one thing you don't want to keep hearing, because you're like, I mean, come on, be for real. I'm an assistant. You really telling me to suction? Like, that's just, that would irk me if I was an assistant and I steady hear the doctor telling me to suction. I'm suctioning. Okay? So main thing is just hold the tongue back, retract, and just keep popping that saliva injector in and out just to collect the water. That's it. Boom, you have a nice patient. She's petite. She's a little young 20-something-year-old, and she doesn't have bad gag reflex, nothing. She's like the ideal perfect patient. So how you will work on her? Lower right side, a molar. Her tongue doesn't even move. Matter of fact, she's helping you out. She decided to just lay her tongue flat, and you're like, what? This is so awesome. All you gotta do is grab your your HVE with your right hand. Pull the tongue back, if you even have to pull the tongue back, because baby, she's helping out. Okay, you just hold it there. Then you can grab your air and water. And then doc's like, oh, okay, she's got it today. She can help me out with clearing out my prep when I need it and rinsing it. Yes. So you just hold it right here and then spray it with air and water and then dry it off and smooth sailing. That's like the easiest thing. So this is just a quick 18-minute life hacks when you're working in the mouth. So I hope that you guys like this video. I will probably do maybe like a charting video. If you guys want me to go over surfaces, teeth numbers, how do you chart and all that type of stuff, let me know. If y'all want me to go over x-rays, let me know. Let me know if you guys just want any questions or any topics that y'all have about dental assisting period, or any videos that you guys want me to talk about, and even more like dental assisting life hacks, then just leave it in the comments below and I will definitely make another video about it. But like I said, I hope you guys like this video and stay tuned for the next one. I'll see you guys later.